Hello students, welcome in our channel. In this session, we are discuss about the hyperthyroidism. So let's start it. The hyperthyroidism very common clinical condition nowadays. It is a basically endocrinal disorder. The thyroid gland is secrete the two main hormone which is a T3 and T4. When the secretion is excessive, the clinical condition is called hyperthyroidism. In the hyperthyroidism, the T3 and T4 is excessive in circulation. So we are discuss the hyperthyroidism in detail. The hyperthyroidism is also known as a thyrotoxicosis. It is a hypermetabolic state caused by elevated circulating levels of T3 and T4 in circulation or blood. Okay. The three causes of thyrotoxicosis is described here. The first one is the diffuse hyperplasia of the thyroid gland associated with the Graves' disease. Here, the meaning of hyperplasia is the cells are increased in number, so they secrete the T3 and T4 in excessive amount. Okay. Second one is a hyperfunctional multinodular goiter. And third one is a hyperfunctional thyroid adenoma. Now we discuss the clinical manifestation of hyperthyroidism. Here the clinical manifestation is described. The first is when the excessive increase of the T3 and T4, it increases the basal metabolic rate of the human body. Okay. Second one is the skin is to be the soft, warm and flushed because of the increased blood flow due to the peripheral vasodilation and also due to the increased basal metabolic rate. Okay. The third one is the heat loss and heat intolerance in common. Okay. The fourth one is sweating is increased because of the higher level of caloriogenesis. It is all due to the increased BMR. Okay, the BMR is called the basal metabolic rate. When the increased BMR is also causes the sweating and a higher level of caloriogenesis. Okay, the fifth one is increase the catabolic metabolism, which is causes the significant weight loss and increase the appetite in patient. In the catabolic metabolism, body cannot store the energy and all the energy is used up. Okay. Now we discuss about the cardiac manifestation of hyperthyroidism. Here they describe the cardiac manifestation. Okay. The cardiac manifestation is early and most common in thyrotoxicosis. Okay. Increase the cardiac contractility, increase the cardiac output in response to increased oxygen requirement. Also present the tachycardia, palpitation of heart and cardiomegaly is present. Okay, the size of the heart is increased is also known as a cardiomegaly. Okay, the arrhythmias, atrial fibrillation is common in older patients. Okay, some patients may develop the left ventricular dysfunction, which is reversible. Okay, here we note the main points of the cardiac manifestation is increase the cardiac contractility, tachycardia, palpitation, arrhythmia and atrial fibrillation, also cardiomegaly, and some patient may develop the left ventricular dysfunction which is reversible. Okay, now we are discuss the nervous system. Uh, the overactivity of the sympathetic nervous system produces the tremor, hyperactivity, and emotional lability. Okay. Also anxiety, inability to concentrate, and insomnia. Other manifestation is a proximal muscle weakness, decrease the muscle mass. Here, the decrease the muscle mass in thyrotoxicosis or hyperthyroidism is also known as a thyroid myopathy. Okay, here also affects the GI system. It causes the hypermotility, and hypermotility causes the diarrhea and malabsorption. Okay, some ocular changes may also present, like overstimulation of superior tarsal muscles, which functions alongside the levator palpebrae superioris muscles to raise the upper eyelid. Okay, now we are discuss about the skeletal system. The thyroid hormone stimulates the bone resorption. Here, the meaning of resorption of the bone is the calcium ions of the bone is enter into the blood circulation. Okay, the calcium ion of the bone is enter into the blood circulation is called the bone resorption. Okay, the thyroid hormone causes the bone resorption. It causes the increased porosity of the cortical bones and reduce the volume of the trabecular bone. Okay, due to the increased porosity and reduce the volume, the increase the risk of the fractures in patient with a chronic hyperthyroidism. Okay, also finds the skeletal muscle atrophy, minimal liver enlargement due to the fatty changes in hepatocyte. Okay, now we are discuss about the thyroid storm. The thyroid storm refers to be the abrupt severe hyperthyroidism. This is a commonly in a patient with Graves' disease. Okay, the patients are febrile and present with tachycardia. The thyroid storm is a medical emergency. Okay, we are discuss the thyroid storm in another session. Now we are describe the normal values of thyroid hormones. Okay, this is a approximately values in adults. Okay, a diagnosis of hyperthyroidism is done by clinical and laboratory findings. Here, the findings is laboratory findings, and we discuss the clinical findings. Okay, we discuss the all about the hyperthyroidism, which is mainly endocrinal disorder and causes by increase the T3 and T4 in blood circulation.